Okay, if you're enjoying a cup of coffee at the back, let me invite you back. I see a few people trickling in. Thank you so much. I see that the technology is working again, which is nice. So this session, I think it's going to be really interesting. I think it's going to pick up off the conversation that we just had. We know that there is a global shortage of some 11 million healthcare workers expected by 2030. So with that in mind, it's really important that practitioners who gain experience and training abroad can bring back new skills and knowledge to strengthen their home health systems as well. That's really key. So in this session, we're going to hear a little bit about some examples where that's actually happening, how countries can reap the benefits of investing in the health workforce and ensure that win-win that we've all been talking about. Let me invite my speaker to come up to the stage. This is Amanda Glassman. Please give her a round of applause. Amanda, you brought your fan club clearly. Amanda is the executive advisor to the president of the Inter-American Development Bank. Before joining the bank in 2023, she had a long and distinguished tenure at the Center for Global Development, where she had many roles, including senior fellow and director of global health policy, vice president of programs, executive vice president, and the CEO of CGD Europe. She is a renowned expert in global health and in global health economics and cooperation, and we used to work together at the Center for Global Development as well. Amanda, thank you so much for joining us. It's terrific to see you.
Thank you, Rajesh, and thanks to the organizers.
All right, so when we're thinking about win-wins, the kind of mythical win-wins, how do you see migration and mobility of health professionals playing both into the opportunity and the challenge?
Yeah, so I think we've all been talking the past couple of days about the shortages that we're seeing in a lot of countries, especially as people age. And in the region of Latin America and the Caribbean, which is what the Inter-American Development Bank works with, we are seeing shortages ahead too. So we're both a region that supports a lot of out-migration to high-income countries, but we're also a region where we're experiencing medical worker shortages already. So for example, about 40% of nursing positions in the Caribbean are currently vacant. So this is a real challenge right away. We also have a lot of mobility within the region. You know, crises like Venezuela have actually resulted in a migratory outflow of millions and millions of people, mostly to Colombia and Peru, Chile. And so we have a lot of regional migration happening too, and all of that together has really led to an emphasis on trying to find these kind of win-win solutions to these populations on the move and to the shortages both at home and overseas.
I just want to focus again on that statistic you just shared. 40% of nursing positions in the Caribbean are vacant.
That's correct.
With your health economist hat on, what does that even mean for people in those countries, health in those countries?
Yeah, I mean, there's just less care to be had, less time for every provider. You know, and so I think the other thing about the Caribbean, of course, is that, and I'll give you some really great examples from the Caribbean of what they're doing to try and ease these kinds of constraints. But it's obviously a binding constraint for health systems that are already, you know, really seeking to try and keep people working in their health systems.
Let's jump into those examples, actually. Tell us about the Caribbean. What's working there that could work elsewhere?
Yeah. So one thing that they do now is to train to the international standard in health provision. So they're trying to, so for example, graduates from university in Grenada, 88% of them pass the US doctor's qualification exam. So that's one thing that they're doing to try and build a group that's ready to work in other health systems, like the UK's, for example, or the US, but that they're also training to have good quality at home. So I think that's one example.
They can take that exam in Grenada?
Correct. I think another example would be they're trying to increase the mobility within the Caribbean islands. So through CARICOM, which is the sort of the economic community of the Caribbean, they are mutually recognizing credentials across the different islands. So if I'm qualified as a doctor in Jamaica, I will also be able to practice in the Bahamas. So I think that's another way to make sure that these kinds of arrangements work best.
Do you have any visibility in how agreement was reached to be able to do that between Caribbean islands?
Well, I think a lot of them were already sharing experiences. They have a regional public health agency that's called CARFA. They have CARICOM itself that has a subgroup that works on health issues. So already ministers are sitting together and talking about the issues. Of course, in the Caribbean, we have a lot of sort of public-based systems that are modeled a little bit on the UK National Health Service. So in that case, you know, the Minister of Health is really the payer for health services. So it helps a bit on the margin. When we're talking about systems that are more mixed, those kinds of shortages play out differently, right? You might have most providers working in the private sector, for example. So you really have to look at sort of what helps reach these agreements.
Well, that's actually interesting. The existence of institutions already where the right players are already able to talk to each other, it means that the trust is there.
That's right.
This
and
is
a process, right?
A trust and a process. Because the politics is actually about both trust and process.
Yeah, absolutely.
Okay, what else? That's really a fascinating example. What are there other kind of examples of circular migration or bilateral agreements that you've seen or that the bank has worked on that you think are real win-wins?
Yeah, so let me first describe a couple of these kinds of bilateral agreements or multilateral agreements that we're seeing in other economic sectors, because actually we're not seeing as many health and care agreements as would really be merited given the demand in a lot of parts of the world and within our region.
Why is that?
Why are there less health and care? You know, I think because a lot of that migration is happening naturally outside of formal agreements. But I think, you know, as those shortages start to bind, we'll probably see more interest in this area. And I would say as the Inter-American Development Bank, we're particularly interested in care work, right? Because, of course, we've been talking about the highly specialized medical doctors, pharmacists, people who have done degrees, but care work actually is something that cannot be replaced by AI, at least in the near term. We don't have the robots out yet. And this is something that's very achievable, you know, training people who might have only high school education or something like that. And of course, we all, you know that elderly parents and things like that, they need help with these day-to-day activities and sort of basic nursing skills. So I think that's a real opportunity for us, and we're working on this actively. But let me give you some examples from other sectors. So we have been supporting Spain and Guatemala in their effort to sort of regulate and organize labor migration flows. These are basically temporary worker visas for agricultural sector workers, mainly picking berries. And Guatemala is the poorest country, one of the poorest countries in Latin America and the Caribbean. And so this is not just good for the sending country who's going to have people come back with skills and remittances. It's good for Spain that has this additional labor force that they need because it's in shortage right now. But it's also
seasonal farm laborers.
Yeah,
right. Okay.
Seasonal
Coming for a short period of time. How long is it normally? Is it just for the season or for a couple of years?
I think it's for the season, but they come back regularly
Right.
every season if everything is going well. But you know, this is also development. It's economic development. It's not just sort of good for the households that are participating or for the farmers that are working.
Because of the multiplier effects of the money that they send home.
Correct.
Right.
And so we're hoping to expand that scheme to things like care workers, right? Of course, there's not a seasonality in care work, but there are cycles, and you could have, you know, limits over time and things like that. Another interesting example is Canada, with Mexico and some Caribbean countries, also has a seasonal agricultural worker program, actually since 1974, which has allowed sort of a government-to-government agreement, again, short time. There are incentives to return home.
Do you know what those incentives are?
So it can be a cash grant to go back. It can be a skills qualification that you can use on labor markets locally. So these are the kinds of things that one can think about to facilitate return.
So that's actually echoes exactly what Guillaume was saying in the last panel, sitting in that very seat, about incentives to avoid the brain drain.
Let me also mention another idea that, of course, comes from our former workplace, the Center for Global Development. We had a colleague who worked on this great idea, which he called global skills partnerships, which we're trying to implement in Latin America and the Caribbean and some countries. So the idea is basically that you're going to overtrain, well, let's say there's a demand for nurses or care workers in Europe. And then a sending country, Costa Rica, for example, could train many more workers than visas that are available in a temporary worker program for care workers. So you would have people that could still be working on the economy with that same skill set where there is demand domestically, and then you could have the group that could go to working elsewhere, providing the care there, and then also coming back. So it's sort of like a training institute that credentials workers for the demand of the destination country, while overtraining so that you have enough domestic supply of that same set of workers.
Why would the, say, Costa Rican government pay to do that? That's going to be expensive.
Well, I mean, I don't think it has to be totally government financed, to be honest, and especially in some of these auxiliary roles. You have private sector workers that are out there too, or firms that are operating. But why? Because of the huge remittances, because of the skills, because of the trade relationships. So it's development, really. You know, countries are already subsidizing university education with return of various levels. This is really an example of something where you can be already engaged with sending workers to go to higher income countries and come back, and then you'll have the added benefit of the workers on the local economy.
Fascinating. More examples?
Let's
This is
see,
really
more.
actually very interesting.
Thanks for saying. Okay. Let me give you another example. We're starting work this year on a certification of competencies at the regional level in Latin America with Colombia, Chile, Guatemala, and Costa Rica. And here the idea is to develop mechanisms for mutual recognition of skills and qualifications.
In health?
In health.
Okay.
So it's health and care workers, as well as construction, tourism, and digital skills. And having not just the mutual recognition of credentials, but then perhaps it could evolve to a mobility program where we could have that match that we need between qualified professionals and opportunities in the labor market, right? Because we have some countries that have an oversupply of medical or care workers, and then we have other countries with an undersupply. So even within our region of Latin American Caribbean, there's a lot that we can do to facilitate this kind of mobility.
So you're learning from experience not only in the agricultural sector with the seasonal berry pickers, but also you said construction, what else?
Tourism and digital skills.
Okay, and so there are examples where the qualifications are recognized between countries, and are there examples of migration programs there?
Not yet, but that's what we're working on. We're trying to get this going, and I would say what's interesting is that the governments are enthusiastic about doing this together. There is another example with the governments of Ontario and British Columbia, Ecuador, and Costa Rica. Again, a skills mobility partnership along the lines of what I discussed. And we're exploring with IOM the idea of mapping the unfilled positions in the Canadian health system in these particular states, and then really helping them train and overtrain to be able to supply some of those gaps. So we're exploring that as well.
That's very interesting. Okay, so we just have a couple of minutes left. If you had to kind of draw out key learnings from what the IDB has been doing and has also supported and seen in Latin and Central America and the Caribbean, are there kind of key things you would draw on that would be helpful for this audience and for the topics we're discussing here?
Well, I think we've talked about them, right? One would be a setup where you're meeting the demands and needs of both the destination country who's receiving the health worker and the sending country, with this idea of overtraining to have labor force still working on the economy at home. We talked about formal bilateral agreements or possibly multilateral agreements where you're matching a predefined shortage with sending country. So, a formal agreement ahead of time with incentives for circular migration, as they call it. And maybe I would just say, and then this mutual credentialing idea, which gives your skills greater portability. And we can see, if you look at the European Union, actually, you can see a lot of that already playing out, sort of as a natural consequence of that single market. But I want to make a little ad for multilateral development banks, like the Inter-American Development Bank, because they haven't always worked in this area. But over the past 4 or 5 years, we've seen IDB, of course, but also the World Bank and others start to be really interested in this idea of health worker mobility, of helping to facilitate some of these arrangements. And I just want to mention a couple of the things that an MDB could provide if a country is interested in doing more work in this space. So one is supporting these bilateral or regional agreements that we've talked about. A second is on knowledge. I'm sure that the OECD does this as well. So understanding what the needs are, what the demand is on both sides, right? So to be able to sort of give you the data, to be able to make useful plans with respect to labor market. We've also worked in regularization of, so for example, these large outflows from Venezuela. We worked with the Colombian government, for example, to enable incoming Venezuelan migrants to work on the economy in their professions. So that was something that was really important because treating them outside the economy makes it very disruptive. It doesn't add to your GDP. So it's really been a win-win there. We also do financing. So we can finance those global skills partnerships with government. We can support private firms that might be, or private universities that are participating as trainers in some of these schemes. And we also work on reforms. So reforming care systems or health systems to be able to sort of adopt some of these practices in the real world.
Okay, that's a fascinating point to finish on. Make sure that the MDB, the regional MDB, is at the table because they have a lot to do in this area. Okay, that was really fascinating. Amanda Glassman, thank you so much.
Thank you, Rajesh.
For a round of applause.